Hi there, good afternoon. My name is Dr. Adheet Gogate from Mumbai, India, and I'm the founder and managing director of HealthBridge Advisors, a healthcare and hospital consultancy firm based in Mumbai. It's a pleasure to be here in Cape Town and see this wonderful country in what is arguably the finest season, at least from what I'm told, to be here. Enjoying the South African hospitality and here to tell you what is it about Indian healthcare that is useful not only for South Africa but for all other countries struggling with the challenge of how to make healthcare affordable and available. A little bit about my home, India. It's an extraordinarily large country, one of the 5 largest growing economies at the moment, and one that has an extraordinary healthcare industry which is unique in being largely free market driven. First, a few statistics. India is a country with 1.2 billion people, with more than 200 languages or dialects across the country, and over 30 different administrative regions that are very, very decentralized in how they run the country and deliver healthcare. India's healthcare industry, specifically its hospital industry, is worth about $70 billion in revenue, a number that is interesting and astonishing for the size of the people that we are talking about. We are talking about a population of 1.2 billion lives being cared for by an industry that is worth at the most $70 billion. How does that happen, and what are the implications of this for India? Right? What has happened is, because India's healthcare industry is largely private, it has focused for the longest time on providing care only to those who can afford it. Not very different from what used to exist, or to a substantial extent continues to exist in South Africa. So therefore, you have a country and a system where 60% of the population does not have access to basic elements of healthcare, such as an ambulance, rehabilitation, step down or paramedical care. But all that started to change the moment India began to develop and become wealthier. As her population, especially her middle class population, grew from 50 million people to approximately 200 million people today, they started asking for affordable health care. India's population is also largely uninsured. Only 15% of Indians have some form of insurance or the other, either state or private. So what happened was 200 million people emerged who started saying, I want health care, but I can only afford to pay a little bit for it. I can't afford to pay what an American or a German or a Japanese person would pay for it. And because the healthcare delivery system in India is largely private, and to some extent in the public sector as well, the industry rose to the challenge and reinvented itself to become a provider of middle market affordable healthcare for these 200 million people. There's a common misconception that cheaper healthcare is obviously going to be poorer quality. But as our analysis and research has shown, there are many Indian healthcare centers whose results or whose outcomes are as good as those anywhere in the West. Surely this is not applicable to the entire country, but it is applicable to a large enough number of players for it to be seen as a sustainable and viable model. How did they do it? What exactly were the changes they made? In our view, Indian healthcare providers did 4 things differently. One is, they challenged the dogma that if this is the standard set by Harvard or Stanford or whoever it is, we don't necessarily need to do that if our people can't afford it. So they tore down how care was delivered and re-engineered every piece of the care delivery process. Indian surgeons, for example, have developed new ways of doing cataract surgery that does not require an expensive phacoemulsification machine, but delivers the same result at a tenth of the price. Indian hospital administrators and doctors working together have figured out how to redesign workflows so that doctors can see 8 or 10 times as many patients per hour than they would have seen in a comparable market in the West. So they have not been bound to standards while striving to achieve them, and they have figured out extraordinarily innovative ways of doing new things. The second departure that Indian hospital players have made is they have never let the best stand in the way of something that is better. They've made pragmatic choices. Faced with the choice of being able to do nothing at all because it was too expensive, and making something that is better but cheaper, better than the status quo but cheaper, they chose the latter, and over a period of 10 to 20 years have achieved extraordinary results. The third thing that Indian players have done differently is they have constantly figured out ways to move up and down the value chain by either manufacturing stuff on their own or by delivering services on their own and so on. But at its heart, at its core, has been the mindset that is born because of this enterprise-driven free market. The mindset of meeting the needs of the market and using the needs of the market to determine how they service those needs rather than the other way around. Of using the constraints and limitations of not having adequate resources, not as an excuse for doing nothing, but as a way to figure out how to do it cheaper, better, faster. And you know what? Despite all of this, India's healthcare sector remains extremely financially viable, with most of the well-run private players returning good sums of money. This has caught the interest of players worldwide, and in the past 5 years, the Indian healthcare sector has seen several $1 billion of private equity investment and venture capital investment, buoyed by the notion that there are completely new and radical ways of delivering healthcare. So in all of this, because of the diversity, because of the rich and the poor coexisting with each other, there was a lot of applications of what has happened in India for a South African audience. South Africa can learn, for example, especially its leading players, on how to use the need to service millions of underprivileged Africans and South Africans as an opportunity. Not as an opportunity to continue doing whatever they're doing, but to make all new models possible. Ultimately, however, for this mindset to prevail, they have to understand that innovation requires some old entrenched mindsets and beliefs to be taken down and to be replaced with newer ones. In our view, the India story has only begun and is far from over. We have a long way to go, and God knows the disparity levels that we have between the rich and poor are very wide, but they are starting to close. We believe over the next 20 years, if innovation brought about by free market, brought about by competition, brought about by letting players succeed and fail and try new things, goes through, India will offer several models and solutions for all other countries to emulate. And that's something for South Africa to think through too. Can it be the creator of a new model of delivering healthcare in countries that have binary outcomes? Ultimately though, for South Africa to be able to do this, it has to change the game and it has to change how it delivers healthcare today. And for that to happen, providers, payers and government must work together to change the rules. If the rules don't change, the game's not going to change, and we will continue with a status quo. So my message to South African healthcare is, change the rules and you will change the game, and everyone will be better for it. Thank you so much. It's been a pleasure talking to you and sharing our views about India.